just as he's been there for his Durham region neighbors. Call John Humphrey today and find out why nobody takes care of you like a State Farm agent. Like a good neighbor, State Farm is there.
My teacher gave me the opportunity to
go to Vimy Ridge to honor our World War II veterans.
Build a school in a developing nation.
Learn how to monitor a heart rate.
Play and record my own music.
Learn sign language.
Plant trees to help save the environment.
I learned how to fix a car.
Start a business.
Represent my school and city at a provincial tournament.
Teachers make a difference.
This is a Dan Carter production.
Well, good Tuesday evening and welcome to First Take Live. Garth Riley here with you tonight. And tonight we're talking to you if you are in pain or you are in pain. If you're in pain, do you have a lower back pain or do you have any kind of pain that's going on that's affecting your extremities, leg pain, arm pain, neck pain, and you thought, hey, I got to go see a chiropractor, and you haven't, or perhaps you say there's no way in heck I'd ever see one because I ain't have any bone crusher, bone cracker, bone adjuster touching me. No one's going to pop me, slam me, or bend me in half. Well, tonight you're going to learn something. Tonight there's actually some breakthrough health technologies that actually, why wouldn't there be, by the way? So there's technologies now that are available to get the adjustment that you need without all the drama that you were thinking about. We'll be talking about that tonight because my guest tonight is Dr. Dave Harper, also contributing author to the Health Secrets Revealed, and is right here. He has been a guest on the show a couple years back, and good to have him with me. Dave, good to have you, Dr. Dave.
Thank you very much. Good to see you, guys.
Yeah, man. Yep. So I see you brought your friend.
I did. My trusty spine,
Listen, the reason I had you come on is because you were pretty excited about some new technology. I'm going to refer to you as the gadget guy, and I because we met over the years at different health shows, and you always were looking for the latest, greatest thing that was going to help your profession of chiropractic. You are a chiropractor.
That's correct.
You own it's called M.O.S.A.I.C Wellness.
That's correct.
And you have been you've been doing this for how many years now?
20 years.
20 years. So you've seen pretty much every doohickey come along that's said that it was going to help a chiropractor there ever was.
Absolutely, Garth. I mean, part of my perspective in my practice is that if I find something that can work better, I'm going to use it. A lot of patients come into the practice and they have their own mosaic of their problem, their own version of something that is going on, hence the name of the clinic, by the way. And so as a chiropractor, I also have become a mosaic in terms of different technologies, whether it's lasers or the Pro Adjuster that we're going to talk about tonight. I graduated 20 years ago from the Chiropractic College in Toronto and began a career in sports injuries, nutrition, using manual methods, and have found that the more scientific, the more authentic we can be in pinpointing where there is a problem in the spine, the better the result we can get.
I guess one would expect that that's possible because we look where medicine's gone in 20 years.
Oh, huge.
And with the diagnostic abilities. And yet chiropractors seem to lag behind.
Well, seem to lag behind is probably the way to say it, but it actually has not lagged behind. This technology that we'll be talking about tonight is a special tool called a Pro Adjuster that has its roots in engineering, actually. Everyone's familiar with the space shuttle, and everyone has been familiar with the fact that the tiles on the space shuttle have come off at different times and had some tragic results. But they've used this type of technology, actually, Garth, to assess the adhesiveness of these tiles to the underside of the space shuttle. The piezoelectric sensor that's in this tool is not something that has been a chiropractic invention, but it has been something that we have applied to the chiropractic ideal.
Okay.
Yeah.
So you're taking technology that currently existed.
That's exactly right.
Found another application for it.
That's correct.
Okay. Your clinic and what you're all about is, we talk about the M.O.S.A.I.C. I think it's important to say a lot of people are long-term sufferers with all kinds of pain. Mm-hmm. Never consider chiropractic as the option to look at. It's you still deal with that fear, with that lawsuit that that was up, and someone said there was a neck adjustment, then they tore the artery, and the next thing you know, the person had a stroke, and that's very unfortunate, not only for them but for the family. But it's not. But the media has not been kind.
Yeah, and I really don't want to be talking about those types of things tonight. I would rather stick with the positivity of the.
Well, let me jump in that for a minute,
All
because
right.
if we don't talk about it, it means we're avoiding it.
Okay.
What there, and I'm not going to go into the side of that, but I just want to say that that medicine itself has its issues. I mean, people have been given improper prescriptions. People have had tools left to them after operation. So the regular medicine model, although you and I understand that, probably the viewers may not, is not infallible.
No.
And therefore, whatever situation they came up about chiropractic, although it made the news, we certainly don't hear about how many times doctors have misdiagnosed. So it's kind of always been this sort of dichotomy, or not dichotomy, probably more I'll just say more opposition to the idea that chiropractic being accepted in the medical field versus the doctors who seem to have that God complex.
Okay, and so I guess the way I will handle that, and I guess what I was saying is I'm not wanting to get political in this comment, but what I will say is that from my own perspective as a practitioner of 20 years, when I saw this technology and began to use it in my practice, people have become, they flock to the practice.
Tell me why. Tell me what's going on with that.
Well, perception or not, the perception in the marketplace can be that the manual type adjustment can have some side effects. While they're minimal and while they're minimized by proper technique, this just completely eliminates everything. And quite frankly, it's more specific.
So hang on, stop.
Okay.
So what you're saying right now is, while somebody may be listening going to add this another bone cracker, I know I'm not slamming you, you're saying that there's a possibility for an adjustment and a rectification without what we know as the pushing and twisting.
That's exactly what I'm saying.
Okay.
And we're using this technology then to both assess the area and then to correct the area and then to reassess the area. So for the first time, in my opinion, in chiropractic, we have a way to demonstrate the subluxation visually to the marketplace. If I was a dentist, it would be quite simple. We could look in your mouth, we could take a picture inside your mouth, and we could show you where there was a problem with any type of dental issue with inside your mouth. All you have to do is look in a mirror. You can't look in a mirror and see what's going on in your spine. And the issue with the spine, and this is something I'm seeing more and more in my practice over the 20 years, I'm seeing more and more people coming in with spinal decay, arthritis, if you will, whatever term someone might be familiar with, as well as disc injuries. Lots of herniated discs in the neck and the lower back, more and more so.
And why?
I think that our lives are more sedentary, quite frankly, and I think that the hygiene that we have become used to for the oral cavity of our mouths really hasn't been applied to the spinal area and its relationship to the nervous system. So if there's a way that we can skip around any type of perceived apprehension and go right at the issue of spinal health and spinal hygiene without any of those issues, it's been a wonderful addition to the clinic. There are people that are coming out of the woodwork looking for something, but wanting something that's gentle and appropriate. And quite frankly, the tested reliability with this in the chiropractic colleges in the U.S. is 94%. What that means, Garth, is that if you come into my clinic and I have Dr. A treat you with the same system as Dr. B, the reliability between those treatments is 94%. That's pretty high.
Right.
So
does it take the skill out of being a chiropractor?
No, it doesn't. I mean, you still have to have the ability to diagnose, to properly assess the patient, to take a good history, to properly look at an x-ray, to properly provide the pathway of diagnosis necessary. But when the actual treatment is provided, it's provided in a way that's gentle, it's consistent, it's comfortable, and it's understandable.
We will go to a break, and when we come back from the break, I'm not going right now, but we will show some pictures of being used.
Yeah.
Now, is this, people say, is it FDA, of course we're always thinking about, is it FDA cleared?
Absolutely. It's been around for about 16 years. There are 22 patents associated with this technology. The technology originates out of Pittsburgh in the U.S. Dr. Mo is the originator of this. And it was cleared for human use and back pain use back in 93 to 95.
Now, So I would have seen it along the way. Has it been now? How long has it been out being advertised? Because the Parker is one of the large chiropractic shows.
Yes.
They used to have a chiropractor. I think the Parker came here. Or
they come to Montreal every year.
Montreal and Toronto, I think, one time.
Yeah.
So have you seen this unit over the years and not paid attention to it?
Yeah, I mean, I ran into this technology several years ago, and it was not part of my scope at the time.
Why was that?
I don't know. I was into nutrition at the time and doing more of that, I think. And my path, like everyone else's path that is on a learning curve, that was just the thing that was at the right time.
So you walked by the booth?
No, I actually went in. I had an adjustment. I had explained to me. I enjoyed the experience, but it just wasn't part of where I was in my path at the time. It's kind of one of those things, where it seems to happen at the right time for the right reasons.
Yeah.
And that's what's happened with me.
People coming into your practice.
Yes.
They're finding out about you. How are they finding out about the fact that you got this gizmo?
Well,
this technology. I would have called it a gizmo.
Well, yeah, we got I got an example of it here that we can talk about on the dry spine. But yeah, it could be a gizmo or a wand or whatever. I mean, people have different names for it. They basically are coming in because they need some type of help, but they want to be handled in a more diagnostic, scientific way.
Then there's a report that comes out?
There's scans. We actually have a computer screen. You'll see in the snip that's coming up that there's actually a monitor that sits beside me and the patient as the patient is comfortably slouched over a modified sitting massage type chair. It's a special C chair that's developed.
We're on the screen right now.
Okay,
so there's somebody there.
So there's a patient that's face forward on the chair, and the doctor is there with the Pro Adjuster in their hand, and the screen is behind him to his left elbow, and that screen is producing a graph each time the sensor is assessing the oscillation of the vertebra. We have 24 vertebrae in our spine, and each of them have to move for us to be able to move. And this system is able to measure 4 specific characteristics of spinal motion. In the past, Garth, I would do that by hand. Very good at it, but there was no way to demonstrate to the patient what we were seeing or experiencing. The patient could not see it. It was something that they had to trust.
So you were feeling through your skilled touch.
Exactly. And in 20 years, you develop an extreme high level of skilled touch. But the challenge is that the patient still can't see exactly what it is that you're experiencing under the fingertips.
What's the value of that to the patient?
Well, it's an extreme value because they can now witness where their spine is having functional problems, like looking in the mouth and seeing something in the mouth or in an x-ray. They can actually see where the subluxation is. And the subluxation is a term that means that the vertebrae are not moving properly. Right. And so this piezoelectric sensor is measuring the lack of mobility or the lack of motion.
So it's measuring it, and it is, people would say that there's different bone densities. There are different fluids in the body. I mean, some people are more hydrated than others. There's different mineral counts, all of this stuff. How is it accurate on everybody? Or 94%?
Well, it's accurate in inter-assessor reliability. So if I'm going to be
put that in English.
If I'm going to assess you, let's say, if I had the system here and I had a colleague of mine beside me that was equally trained, if I was to scan you and then he was to scan you, there'd be a 94% reliability.
That you would be very consistent.
Exactly. Okay. Exactly.
All right, but what about the, so there's the accuracy. All right, we're going to go to break. We're going to come back and talk a little bit about what people are thinking about, what they, what they may be concerned about, what kind of pain they're living with, and can chiropractic be, I think a lot of people would be surprised at how much the spine adjustment does work. But we'll talk about that. Okay. All right, so tonight, are you suffering a long-term suffer of pain? Is your friend called Advil and Tylenol and any other kind of painkiller, not picking on either one? And have you been having to use those things in order to get through? And is that part of your weekly shopping experience to make sure you have enough of those in hand? I remember in my house for a while, Advil was part of the weekly shopping menu item. So I want to talk to you tonight. Call in tonight if you have some concerns about the pain you're feeling, the loss of power, loss of mobility, and what can be done with this new technology. Perhaps it can help you, and then you don't have to worry, and yet you can feel better. How's that? Stay with us. First Take Live continues right after this.
Time to take care of that unwanted hair? What are your options? You can rip it out, pluck it, melt it away with harsh chemicals, pay for costly laser treatments, or that old standby shaving.